What exactly is hypertension and why is it known as the silent killer?
So pressures beyond 140 by 90, that is defined as hypertension.
Right.
And you rightly said it's a silent killer. Hypertension is called silent killer because as such elevated blood pressure doesn't cause any symptoms.
Is there a trend between the numbers? Is there a specific range that elderly people witness in their blood pressure or people with comorbidities?
People who have multiple comorbidities more than 85 years old, you should keep their pressures around 130/80. Don't be too aggressive in controlling their blood pressure.
And do sleep patterns also affect blood pressure?
Yes, sleep patterns do affect blood pressure.
I do want to talk about a very popular phrase that we hear, that laughter is the best medicine. Is that really true?
Yes, laughter, it helps to release certain good chemicals, good hormones, endorphins. So that's how these good chemicals are generated, and because of which it helps as a relaxation.
Right. There is a notion going around, quite a popular one, that some amount of red wine helps in controlling blood pressure. Is that true?
Red wine definitely has proven that it controls your triglyceride levels. It improves your HDL cholesterol levels. So it is beneficial. Even in hypertension, it is beneficial. But it should be a de-alcoholized red wine. It's a common myth, salt alone increases your blood pressure. The recommended dietary intake is hardly 4 to 5 grams in a day. But data from Indian data have shown that we consume almost 7 to 8 grams of salt in a day. So it's almost double.
Hello and welcome to another episode of Heart Talks, where we bring you expert insights in simpler words so that you can take charge of your own heart health. I am your host Shreya Dadich, and today I am with Dr. Prashant Pawar. Welcome, doctor.
Hey.
You and I are here to talk about another silent killer, which is also known as hypertension. But before we dive deep into the questions, I would like doctor to tell us a little bit more about his practice.
Myself, Dr. Prashant Pawar, consultant cardiologist, practicing in Seawood. I have my clinic there, Dr. Pawar's Healthcare Center, and I practice at Fortis Hospital, Vashi. I deal with all complex coronary angioplasties. I deal with heart failures, pacemaker devices, peripheral plasties, and patients who required heart failure devices like ICDs, CRTDs, and nowadays newer modalities like TAVI.
Thank you so much, doctor. As our expert today, my first question to you is, what exactly is hypertension and why is it known as the silent killer?
Hypertension, if you see a blood pressure, it has two values. The upper value is called as the systolic blood pressure, and the lower value is called diastolic blood pressure. So the upper value usually is between 120 to 130. So you have a range. People usually have a myth that 120/80, 120/80. It's never like that. So upper blood pressure between 100 to 120 is a normal value. A lower blood pressure between 60 to 80 is a normal blood pressure. When the pressure starts rising up beyond 140 upper value or lower level beyond 90, that is called as a hypertension. So pressures beyond 140 by 90, that is defined as hypertension. And you rightly said it's a silent killer. Hypertension is called silent killer because as such elevated blood pressure doesn't cause any symptoms most of the time. So like heart patients, they get chest pain, they get sweating, they get palpitation. But people who have a hypertension, they don't have any symptoms as such. That's why it is missed. Problems occur, or when it is detected, by that time the complications have already started. Either like stroke or kidney problems and all. So yes, if not rightly diagnosed, blood pressure causes complications, which leads to serious side effects like stroke, heart diseases, heart attacks, heart failures, kidney problems, peripheral artery disease. That's why early recognition is required. That's why it's called as a silent killer.
That's very well put, doctor. I would like to understand, you described the numbers appropriately, but is there a trend between the numbers? Is there a specific range that elderly people witness in their blood pressure or people with comorbidities?
So see, this age is just a number. This number, what we are seeing of blood pressure, see, it varies according to age. When person age, the arteries start thickening, because of which the blood pressure starts rising up. So usually what has been found that blood pressure, hypertension occurs at elderly age group. So when we want to have a cutoff values to control the blood pressures, usually we say that blood pressure should be between 130 to 80. But in elderly patients, what has been found even with our trials, that octogenarians, especially patients who are more than 80 years old. In those cases, if you try to bring down their BP too aggressively, like 120 and all, they get giddiness, they fall, they have stroke, they fall down, they get fractures. So people who have multiple comorbidities more than 85 years old, you should keep their pressures around 130/80. Don't be too aggressive in controlling their blood pressures.
Right. And what exactly causes blood pressure in the first place?
Now, blood pressure is not a disease as such. Hypertension is not a disease. Most of the time, there are other causes which causes this elevated blood pressure. Like you say, fever is not a disease. We see fever because of pneumonia, because of urine infection. So, like that, hypertension, most of the time it has causes. One cause, age, advancing age, there will be a little rise in the blood pressure. Second, comorbidities like diabetes, thyroidism, or patients who are obese, or patients, most commonly they have a kidney problem. So youngsters, they have either kidney vessels which are narrowed down, called as renal artery stenosis, or patients who have kidney stones, or patients who have underlying kidney disease, they have elevated blood pressures. The other risk factors are like common nowadays, what we see youngsters, they come with because of stress, or sleep disturbance because of night shifts and all. So they have a disturbed sleep that causes this elevated cortisol. When the stress level is high, your cortisol, a chemical in the body, is high, that raises your blood pressures. Sometimes people who have, mostly they have smokers or they have alcohol intake, they have a high blood pressures. Dietary factors, if you see, people who have a high salt intake, they have high incidence of hypertension. Who have a high saturated fat intake, less of potassium, less of magnesium, less of green leafy vegetables, they are more prone for this hypertension. So it's a multifactorial disease. Sometimes it's called a secondary hypertension. People who have certain diseases linked to our hormones, like hyperthyroidism, or some patients have increase of cortisol level, they have a high blood pressure. So endocrine diseases are also linked with hypertension.
And what should a person do the moment they detect that they are diagnosed with hypertension? Should they immediately turn to medicine, or is there something they can do by themselves at home?
So once hypertension is diagnosed, that means once their blood pressure levels are beyond 140/90, so definitely they require some sort of treatment. So treatment here, one is lifestyle change, that is very important. I told you the most problem is the issue with the stress levels. So if they can start with some physical activity, exercise, aerobic exercise, cutting down on this smoking, alcohol, having a proper sound sleep, at least 6 to 8 hours of sound sleep is required. That helps to control the pressures well. Certain diets which are known to control your blood pressure, where you have high potassium, low sodium intake in the diet. Especially our Indian foods, if you see, we have a lot of salt intake, snacking, So indirect salt intake comes from biscuits, chips, farsans, wafers. Even this pani puri, that's a rich source of salt, that increases your blood pressure. So cutting down on this diet is also important. Then comes medications. So definitely a point comes where you have to be on medications. Most of my patients, youngsters especially, they say that, doctor, I don't want medicines. See, but you can't get away with the medicine. They are being fed up. They have been hearing all this social media and all, where they say that medicine causes kidney problem. Then I tell them, I show them this. No, if your BP doesn't come under control early, then what is the role of having all these things? So sometimes medicines are required, and you have to be on medication. You can't get away from that.
And would you advise that patients, when they get their BP under control, sometimes they cease the medication altogether? How would you comment on that?
So that's called brittle hypertension, where there is a borderline elevation in the blood pressure. What I said, sometimes you have a correctable causes. Patients are hypothyroid, you control their thyroid levels, the pressure settles down. Patients are obese, they reduce their weight by 5 to 8 kg. Definitely the pressure, it has been found that if you reduce your weight by 10%, almost 10 to 15 mm control of your systolic blood pressure occurs. So if you have corrected those problems like diet, your alcohol, smoking, weight loss, your lifestyle changes, exercise, definitely it helps in controlling the blood pressures, especially brittle hypertension, or they have a reversible cause like renal artery stenosis. I said the blood vessels supplying the kidney is narrowed. You keep it open by either ballooning or stenting, and the pressure settles down. So in some cases where you have a reversible cause, the pressure settles down without any medications. But most of the time, by the time they are being diagnosed hypertension, especially in our country, it's quite late. You require medications.
Right. And you spoke of supporting managing your hypertension or blood pressure with diet. What do you suggest? What should a diet's focus be then in this case?
So the diet, it has been found that certain foods, they are known to control your blood pressures. So what I said is, first was salt control.
Right.
Salt has most of it sodium. So sodium is the culprit for the hypertension. If you control your salt, if you control your sodium intake, definitely the blood pressure control occurs. So mostly nowadays you get a lot of pink salt, Himalayan salt, rock salt. So all these salts, it's not the color what matters. What it has is high potassium content.
Right.
It has less sodium intake content. So less sodium, more potassium helps to control your blood pressures well.
Right.
Second is, there are certain diets called as a DASH diet. So dietary changes to stop hypertension. So the DASH diet or Mediterranean diet, which is more of a green leafy vegetables, more of fruits, more of whole grains, that helps to control your pressures well.
Right.
Third, I said control your smoking, alcohol, tobacco intake, and having a sound sleep is very important.
Right.
Now coming to certain food ingredients. Certain food ingredients like bananas. Bananas have more of potassium.
Right.
What potassium does it? It helps in the kidneys to flush out your sodium. So it
Right.
helps to control your blood pressure.
Right.
Beetroot. Beetroot has natural nitrate, which converts to nitric oxide, which is a vasodilator, which dilates your vessels and your pressure settles down.
Okay.
Pomegranate. Pomegranate has certain enzymes which inhibits your angiotensin converting enzyme, which also controls your blood pressures. Ginger.
Nice.
Ginger is a natural calcium channel blocker. Calcium channel blocker we give a medicine for controlling blood pressure. So it's a natural calcium channel blocker. So these are the ways, various
Right.
ways. If you involve that in your diet, it helps to control your blood pressure.
Right. Now that we've covered diet, I want to now talk about exercise.
Yeah.
What are there any specific exercise that you recommend for controlling blood pressure?
Yeah. So exercise definitely helps to control your blood pressure. The main important exercise is the aerobic exercise. So sprints, what we say is either jogging, cycling, swimming, so running, brisk walking. It helps
Right.
to control your blood pressures. The other are strengthening exercise. What usually people do in the gymnast. So the weightlifting or squats or lunges. So this helps for the heart to pump better way. So the
Right.
pumping is better. That's how it controls your blood pressure. Other goes like meditation. The mind-body exercises like yoga, tai chi. They help as a relaxation. That how it controls your blood pressure in a better way. So you can go to it, exercise, diet, and medications. All
Right.
helps to control your pressures.
Right. And I do want to talk about a very popular phrase that we hear, that laughter is the best medicine. Is that really true?
Yes. Laughter, it helps to release certain good chemicals, good hormones, endorphins. So that's how these good chemicals are generated, and because of which it helps as a relaxation.
Right.
So many of our patients, they go to this laughter clubs and all, and they do better. Almost 5 to 10 mm reduction in the blood pressures are there.
Right.
So it's all together it helps. But you're right, laughter is the best medicine.
And that's now that we've heard it from a doctor himself at this point, so nothing better than that. And I do want to ask now, as a cardiologist who has been practicing for over a decade now, what is one advice that you wish your patients would just listen to when you would offer them?
Yeah, I usually tell my patients walk.
Right.
Because most of us, we don't do exercise. So from that side of the table to this side of the table, everyone is busy in their schedule. No one gets the extra time. Everyone will get those 24 hours where they'll be working, hardly any time for exercise.
Right.
People say that I go to office, I travel 3 hours and all. So what I recommend them is to keep walking whenever they get time. If they are on phone calls with some clients, if they have some meetings which can be managed on phone, just connect a headphone and walk. Avoid lifts, use staircase, walk up and down. At least utilize that office time for walking almost 10,000 steps. So this is like aerobic exercise. Brisk walking, if you do, it's like aerobic exercise. It controls your blood pressures well.
Right. And as a cardiologist, what is one thing that you will never do in your life for your heart health?
Yeah. Never drink. Because I feel, drinking is the most common culprit what I have seen in my patients, where they indulge in over drinking. There's nothing
Right.
like moderation in our country, What all Western papers say, there's all moderation. In our country, nothing is moderation. So it goes on, and then they blame doctor. Doctor started it. So what I feel is that don't drink.
Right.
If you drink in moderation, stop it if possible. That is the easiest way to get away from all the heart problems.
That makes a lot of sense. Doctor, now that you have told us about the numbers, I want to know how can we monitor our own blood pressure?
Yeah, so that is called as a self-monitoring of blood pressure, where a patient can check their blood pressures even at home. There are certain tips, before checking the blood pressure. One is, before checking the blood pressure, patient should not have coffee or tea, dark chocolates, or he should not have something energy drinks like Red Bull and all.
Right.
Second, the bladder urinary bladder should not be full. He should empty his bladder. Other is rest. So at least 5 minutes of resting is required to allow the body to relax before checking the blood pressure. Patient should check the blood pressure in a sitting position in a chair with the back rested, like the way we are sitting, with the legs resting down on the ground, not dangling around, not to cross your legs, so uncrossed legs. The arm should be having a rest where the hand can be rested. Then electronic blood pressure apparatus nowadays are easily available. A good quality electronic BP apparatus where the cuff should be covering at least 40 to 80% of the arm circumference is to be connected. Patient should not himself look at the BP apparatus while checking the blood pressure. Someone should help to check the BPs. Because the moment we start seeing those numbers, automatically the blood pressure elevates.
Oh.
And he should take 3 readings, out of which first reading should be discarded.
Okay.
An average of second and third reading should be taken. That's how proper BP monitoring can be done at home. And we usually recommend them to do it home so that they do a better control. Once the pressures are high, they inform us, and that's how we adjust the medications.
Right. That's interesting. And I would also like to understand, is a person who is asymptomatic also at a risk of hypertension?
Yeah. So most of the time, I told you, it's a silent killer. So most of the time, they don't have any symptoms. But if you see the numbers, 180 is upper value, lower value above 100 and all. So the time they start developing symptoms, complications have already set in. So it's called as a silent killer. So even though the patients are asymptomatic, if the pressures are high, they should be worrying. But only worrying is of no use. They should be on this lifestyle changes. They should be on medications, because the complications like stroke, heart attack, heart failure, kidney problems, they set in.
So the biggest indicator is always a higher number.
Higher number.
One need not wait for any other symptoms.
Early the better, lower the better. You control your blood pressure as early as possible.
Right. And let's assume that someone who is diagnosed with high BP has now gone on medication. Sometimes we tend to miss out on our dosage. Yeah. What do we do in that case?
It's quite common, especially in elderly age group or working class, where they are traveling and they miss the tablet. So whenever you remember, you have missed the dosage. Whenever you remember that, pop in the tablet. That's the easiest way to be done. Second, but if the dose of when you are remembering, by the time if the next dose is coming, don't take 2 tablets at the time. You take this tablet, forget the next dose, and take the tablet, the next dose, and the next day. But don't take the 2 medications within 1 or 2 hours difference. Otherwise it will drop your blood pressure significantly. Right. So whenever you remember it, take the dose.
Right, makes sense. And there is a notion going around, quite a popular one, that some amount of red wine helps in controlling blood pressure. Is that true?
Red wine definitely has proven that it controls your triglyceride levels. It improves your HDL cholesterol levels. So it is beneficial. Even in hypertension, it is beneficial. But it should be a de-alcoholized red wine. Sometimes nowadays they mix alcohol and red wines. So it has to be a de-alcoholized red wine. Now, why red wine is important and how it benefits is that it has certain chemicals called as polyphenols. The polyphenols are like an antioxidant.
Right.
It's a vasodilator and helps to control, it helps to relax your blood vessels, because of which blood pressure controls softer. So red wine definitely is beneficial, but it has to be taken in a moderation amount. You have to benefit the risk and the advantages of it, and moderation never happens in our country. That's the problem.
That's true. What would you say is the moderate amount that suits a person?
So what the data says that 1 or 2 drinks, at least 3 to 4 days, not crossing more than 4 days in a week.
Okay.
But it doesn't happen in our country.
Right. And what about people who are not drinking alcohol at all? Do they find polyphenols in any other foods?
Yeah, I told you, polyphenols are present in other food. Grape juices,
Okay.
that has that. Pomegranate has that.
Right.
So those sort of things are definitely present in few natural ingredients also. You don't have to always have a red wine for that benefit.
Speaking of notions, doctor, there is another popular one that salt is the sole culprit of high blood pressure. What do you have to say about that?
Yeah, it's a common myth, salt alone increases your blood pressure. So definitely not. Some small amount of salt is required for normal functioning of our body's functions, But salt, if it is in excess, definitely it will cause excess of sodium, and that sodium is the main culprit for the elevated blood pressure.
Right.
Salt has two components, sodium and potassium also in it. Potassium is beneficial.
Right.
So salts which are rich in potassium, they are beneficial. But alone salt is not a culprit for hypertension. Many times we have seen that patients, they don't eat salt much, but their BP is elevated. These are called as a salt-sensitive hypertension.
Right.
So in those cases, we need to cut down salt significantly, below 2 grams, to control their blood pressures. But other risk factors are also there, like smoking, sleep, obesity. That also are equally important to control your blood pressures.
Right. And is there a daily intake limit to salt? Certain grams?
Yeah. The recommended dietary intake is hardly 4 to 5 grams in a day. But data from Indian data have shown that we consume almost 7 to 8 grams of salt in a day. So it's almost double of the recommended dietary allowances. Indirect salt intakes are too much in our things like papad, pickles, biscuits, and the pani puri. These are the indirect salt intake, which contributes to the sodium and which increases the hypertension. If you see the prevalence of hypertension in our country is almost 30 to 33%.
Right.
So out of 100, almost 1/3 patients, almost 1/3 people are hypertensive. I won't call them patients. So that is the incidence rate of hypertension in the country.
Yeah. And as averse to table salt, is pink salt, rock salt, these options, are they better than table salt?
Yeah. So what our ancestors used, that was right. They used to use the rock salt. This rock salt or Himalayan salt, they have more of potassium, which is a beneficial, and less of sodium. So that was the right combination. So it doesn't increase your sodium level in the body and helps to control the blood pressure. But at the same time, what we are seeing is the quality, and second is the quantity. The quantity also of that, even the rock salt, pink salt, should be low to control the blood pressures.
Right. And blood pressure is something that fluctuates between ranges. So does it fluctuate throughout the day as well?
Yeah. So that is what we call it as a circadian rhythm. So before we wake up, the blood pressure starts rising. It has its peak around by afternoon, and by late afternoon the pressure starts reducing. And in the night time there is a drop in the blood pressures. This is the usual variation. So night time, that we call as a night dippers. The drop in the blood pressure should occur. In few patients, nighttime BP doesn't drop. Even those are at risk for heart diseases and other problems, where you need to tackle that. So nowadays we have certain devices called as ambulatory BP monitor, where the patient wears the BP cuff, the mobile-like device records the blood pressure, and we get the circadian variation of the BP.
Okay.
So few patients, they have elevated blood pressures at night. In those cases, we need to add some tablet at the night so as to control their blood pressure, so that the complications doesn't occur.
Interesting. And do sleep patterns also affect blood pressure?
Yes, sleep patterns do affect blood pressures. Recently, since post-COVID, we are seeing so many people who are coming with elevated blood pressures. It's not that poor virus which we should blame for the hypertension, but I feel it is all more of electronic gadgets. Everyone is busy in their OTT platforms, especially at night time. They use those mobiles till the time they discharge, or they sleep at 1 o'clock, 2 o'clock. Because of the poor sleep pattern, the hormonal effects are also imbalanced, because of which the blood pressure rises up.
Right.
So people who don't have a sound sleep, I don't say sleep, I say sound sleep, because we have two patterns of it, REM sleep and non-REM sleep. If they don't have a good sound sleep for 6 to 8 hours, it affects your chemical things in the body, and the blood pressure rises.
Right. So we understand this in case of people who are not sleeping sufficiently or getting those hours in. But there are also many people who actually get their 8 to 9 hours, but they sleep at different hours than generally known.
Especially IT sectors,
Yeah.
they work at the night,
Yeah.
and that continues for that whole week or maybe
Yeah.
month. So they are prone for hypertension. If you see the prevalence rate of hypertension, especially in this night shift workers, it's more as compared to other population who works in the daytime.
Right.
It affects your hormonal and the chemical levels, and because of which the blood pressure incidence rate is high in this population.
Okay. So it's always recommended to follow the circadian rhythm that we talked
Recommended,
about.
but you can't change the job.
Right. That's also true. Well, you've helped us out with a lot of our queries today, Doctor, and I'm sure the audience now knows how to take care of their own heart health. Now that you know how to deal with hypertension, you can now take its power and not let it be your silent killer. Thank you for joining us. Thank you for joining us today,
Thank you.
Doctor. And we'll see you in another episode.